Hello everyone, now let us discuss about changes in emergency department E&M coding in 2023. There are certain guidelines for ER department coding. The following codes are used to report evaluation and management services provided in the emergency department. The first important point is there is no distinction is made between new and established patients in the emergency department. That there are no separate codes for new or established. There is only one set of code. One code set, whether the patient is new or established. An emergency department is defined as an organized hospital-based facility for the provisions of unscheduled episodic services to patients who present for immediate medical attention, and the facility must be available 24 hours a day. And for critical services provided in the emergency department, see critical care notes and CPTs 99291 and 99292. The 2023 documentation guideline changes do not impact the critical care codes. That is 99291 and 99292. One important factor is time is not a descriptive component for the emergency department levels of E&M service. This is an important point. Now, let us see further details regarding the emergency department visit. Coming to 2023 guidelines for emergency department, the new guideline simply requires a medically appropriate history and physical exam, which makes MDM the sole factor for code selection in 2023. Previously, emergency department used to require all three components. That is, it used to require a history, physical examination and MDM. But according to 2023 guideline, it simply requires a medically appropriate history and physical exam. And MDM is the sole factor for code selection in 2023. And MDM will still be based on the modified historic 3 MDM components. That is the 3 components of MDM. That is number and complexity of problems addressed, amount or complications, or the amount and complexity of data to be reviewed and analyzed. And the third is risk of complications or morbidity or mortality on the patient. Number of problems addressed, amount and complexity of the data reviewed, and the risk of morbidity and mortality. These 3 components are still considered. And in 2023, the highest 2 of 3 components of MDM will be used to select the level of an emergency department E&M code. So in these 3 components, highest of 2 out of 3 components of MDM will be used for the selection of appropriate level code for an ED E&M code. And the level of MDM concept will not apply to the code 99281. This is also important. The level of MDM concept will not apply to the code 99281 since this level of service will not require the presence of physician or other qualified healthcare professional. 99281 does not require physician or presence of physician or other qualified healthcare professional. So level of MDM concept will not be applicable to 99281. And the ED&M services and critical care services may be reported together. These are the 2023 guidelines for emergency department. There is still continuation in the next slide. Coming to next point, nursing staff may report 99281. To report 99281, nursing staff will need to ensure documentation of the service performed and clarify that the work they performed is not part of another separately reportable service. Code 99281 could be reported to remove suture materials, dressing change or any other separately reportable services if the provider is not reporting an E&M during the same encounter. So nursing staff may report 99281 according to the new guideline because it does not require the presence of physician or other qualified healthcare professional. Next, Time is not a factor when choosing ED levels of service. Since ED services are typically provided different levels of intensity, often involving multiple encounters with several patients over an extended period of time, tracking accurate time spent on each patient would be nearly impossible during the concurrent active management. So time is not a factor when choosing ED levels of service. Next is medical necessity. The physician or qualified healthcare professional will have to consider whether the nature of the presenting problem supports the medical necessity of the services rendered. The medical necessity will be predominant criteria. The medical necessity will be the predominant criteria for selecting the level of emergency department E&M service. So here we have discussed 3 points. In addition, nursing staff may report 99281. Time is not a factor when choosing ED level of service, and medical necessity is a predominant criteria for selecting the level of ED E&M service. Now coming to the 5 codes of emergency department. They are 99281, 99282, 99283, 284 and 285. So 99282 requires straightforward MDM, 99283 requires slow MDM, 99284 requires moderate MDM, and 99285 requires high MDM. Now let us discuss each code with example. First is 99281. ED visit for evaluation and management of a patient that may not require the presence of physician or other qualified healthcare professional. And usually the presenting problem are self-limited or minor. Let us see an example. Emergency department visit for patient for removal of sutures from a well-healed uncomplicated laceration. Next is 99282. ED visit for evaluation and management of patient which requires a medically appropriate history and or examination and straightforward medical decision making. 99282 requires straightforward medical decision making. And usually the presenting problems are of self-limited or minor. Let us see an example. Emergency department visit for a child presenting with several uncomplicated insect bites. Next is 99283. ED visit for the E&M, evaluation and management of a patient which requires a medically appropriate history and or examination and a low decision making. Usually the presenting problem is of low severity. Let us see an example. Emergency department visit for a child presenting with impetigo localized to the face with the use of topical OTC treatment. Next is 99284. ED visit for evaluation and management of patient which requires a medically appropriate history and examination and moderate medical decision making. 284 indicates moderate medical decision making. Let us see an example. Emergency department visit for a 4-year-old who fell off a bike. He sustained a head injury with brief loss of consciousness. This leads to moderate severity of the problem. So 99284 can be coded. Coming to 99285. ED visit for the evaluation and management of patient which requires a medically appropriate history and examination and high medical decision making. Usually the presenting problem are of high severity and pose an immediate significant threat to life or physiological functions. In order to, the medical necessity would be problems with high severity and which poses an immediate threat to life or physiological function. Let us see an example. Emergency department visit for a patient exhibiting active upper gastrointestinal bleeding. This needs immediate attention and the complexity will be of high severity in this case. Hence, you need to code 99285. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.